Why some hospital workers are still refusing COVID vaccines. Healthcare workers are the world's first line of defense against COVID 19, and they deserve to be the first to get vaccines. While in some corners of the world, many have been vaccinated already, there are still those who refuse to get a dose due to concerns. This refusal can become a major problem because average people may do the same. And when that happens, a new gap in the vaccination campaign may arise. At Houston Methodist, a 47-year-old had served for at least 10 years as director of corporate risk. They hope to retire and relax soon. However, they got fired in April after refusing to be injected with a COVID-19 vaccine. They were one of the two managers who refused to be vaccinated, while others have until June 7 to comply. It was Bob Nevins, and his concerns are not about conspiracy theories or busy schedules. It was about the FDA's quick decision and science may not be fully aware of the long-term side effects. I don't want to take an experimental vaccine. We don't know what it's going to do to somebody 10 years from now, he said. He said he is convinced that he developed some immunity against the disease based on travel history. He and his wife traveled to Hawaii back in December 2019, the time when the novel coronavirus emerged in China. But he has no evidence that he got the infection at that time, and when his antibody test came out, he was negative. Still, he isn't convinced that he doesn't have built-in immunity. According to a survey by USA Today, Nevins is just one of many employees at different hospitals who remain unvaccinated. In the survey, 9 hospital networks responded and they reported that fully vaccinated rates were between 53% and 72%. While the rate in the 15 largest public hospitals in the US was from 51% to 91%. Many of these hospitals are below the 70% goal of US President Joe Biden. Dr. Joseph Varon, Chief of Critical Care at United Memorial Medical Center, is confused as well. About 40% of nurses Varon worked with in a COVID unit still declined to be vaccinated. Some hospital workers appear to have a big issue with FDA's unusual decision to quickly grant conditional approval on COVID-19 vaccines. Although these vaccines aren't commercially sold, workers know none of them received full approval yet. Until then, new tactics must be applied to ease doubts and increase vaccination rates among healthcare workers.